Today I am reading from the book Spirit of Homeopathy, book written by Dr.Rajan Sankaran. Mind section, chapter number 33, Technique of Case Taking. Case taking is so easy and yet it is the most artistic and skillful procedure. In case taking, the internal state of the person in front of you is gradually revealed. It is a very interesting and fascinating experience as much as it is fascinating to know yourself. There are really no standard techniques or fixed rules in case taking. It is just an effort to understand the person in front of you, and one can use any technique to suit one's temperament. I sometimes joke with students that if necessary, you can even take the patient out for dinner in order to know everything about him. As long as you are able to feel the patient's feelings, whatever techniques you are using is good enough. But in my practice, I have evolved certain techniques that have helped me immensely. These techniques are the practical application of all the ideas that have been mentioned in the various chapters of this book. I have tried to collect them all together here and to illustrate their utility in the clinic. For fuller understanding, the reader is advised to refer to the original chapter themselves. And none of these techniques is absolute nor compartmentalized. They are all interlinked. Naturally, they have certain things in common. They are not to be followed like a rule book, one after another. Rather, you will often need to jump from one to another. You can devise your own technique. It is not necessary to use all the technique in every case. As we go through this technique one by one, I shall give example and explanation. Now, under label observation, it is the most important and useful technique and the one that needs to be developed the most. In fact, if we train ourselves well, many a time observations alone is enough to know the patient. It begins right from the time the patients make the appointment or when you meet him outside the clinic situation. Observation has to be totally unprejudiced, which is why Hahnemann used the expression unprejudiced observer, and by so doing he laid down the most difficult condition. In fact, I can say that if you have learned to be an unprejudiced observer, you have learned now to live and how to relate, because we also always judge the present from the viewpoint of the past. This is prejudice. When we see something, we link it to the similar experience in the past and we say this must be like this or that, and thus we deny ourselves the experience of something totally new. The person in front of us is absolutely unique, and our present experience with him is also for the first time. With this in mind, we have to observe without interpreting his action hastily into this or that remedy or ideas. The day we start fitting people into the category or remedies and we think we know people before we really observe, that day we have become useless as a homeopath. So, what do you observe? Basically, you observe what is it in the person that make him an individual. What is it that make him different from other people? For example, the way he makes an appointment. One patient will say, "Doctor, I would be so grateful if you could see me," and another will say, "Doctor, I must see you immediately." There is a difference in these two way of asking, which shows the state of mind at that time. Observe how he conducts himself and how he has filled in questionnaire form, how punctual he is, how he is dressed, how he enters, how he sits, at the edge of the chair or behind behind the chair, what his hands are doing, what his feet are doing, his facial expression, his manner of communications, and how he reacts to the person he has come with. If he has brought some medical files, how well he arranged them, how he has brought them, has he brought them at all. Even single things has to be observed: his movement, his posture, his speech, the way he explained himself, and what atmosphere he created in the room. None of them really indicate the remedy, but the state of the frame of the patient's mind. This will be the confirmation by other information later. But during this initial observation, looking and feeling are important. One good way to begin an interview is to put your observation back to the patient and ask him if he is experiencing this. From here, you can get straight into the heart of the case. For example, you might say, "You seems to be so tense. What is what bothering you?" Or, "You seems to be very in hurry." He's caught unaware and answer spontaneously jumps out. Now, if you attempt to go behind the answer, you will straightway find something very deeply in his personality. I had an interesting experience in Germany when I was in the clinic of one of my colleagues. There, she was interviewing the patient in German, a language I do not understand. Yes, I was able to tell the remedy. This experience I have had several times, especially in non-English speaking countries. Even in my clinic, there are people who speak language I do not understand. You just have to develop this kind of observation. In children especially, observations play an important role. I will mention one case where observation helped me in a prescribing. It was the case of a 24-year-old unmarried girl who worked as a research scientist in the research institute. She presented with a chronic cough. I observed that her hands were very restless, and along with this, she would glance from side to side to see if anyone else was in a room or not. Even though she easily gave a lot of physical complaint, when I came to her mind, she would become silent and again glance around, saying little and answering no to most of the questions. This whole attitude, secretive glancing from side to side with the restless hand, was noticed by me and gave me the idea that she was behaving like a criminal. The rubrics are restless hand, answer in monosyllables, no to all the questions, delusion she has committed a crime, and I gave her a Kali brometer medicine. There is another rubric, delusion thieves accused of robbing in Kali brometer present. Then I asked her, "Why are you so scared? What have you done that is making you so worried?" She was taken aback and told me how she was in love with a scientist from the same institute, and this was not approved by their parents, and so they had to be keep it all in a secret form. This was a surprising because both the independent and could just have announced it and got married. She felt as though she was committing a crime, and that other word just crime, and that other would find out. I gave her a Kali brometum and she did very well, and ultimately he married to the same man. My observation was confirmed when I asked what her interests and hobbies were. She liked to play the sitar, and play the sitar, which is involving the use of the hands. She liked to keep busy mentally and physically, especially with her hand. In conclusion, observation is aimed at trying to understand the state of mind of the person. The observation has to be accurate. If you see a restless child, ask what kind of restlessness is there in the child. Does he want to change place, or is it the restlessness of touching things or changing occupation, or is restlessness of a kind in which he wants to be carried about? What feelings could lie behind this restlessness? Such accurate and sensitive observation is a sign of good homeopath. That is why Hahnemann wrote in the aphorism 211 about observation. This holds true to such an extent that the state of disposition often chiefly determines the choice of the homeopathic remedy, being a decidedly characteristic symptom that can list of remain hidden from the accurately observing physician. He placed so much emphasis on the observation. Now under label mode of narration of complaint. If you develop sensitivity to hearing the patient's manner of narrating his complaint, you will often be able to prescribe on the technique to the exclusion of all others. It will shows his state of mind and his attitude towards his illness. Usually the attitude towards his illness is representative of his general attitude and his emotional state. Different people will react to the same illness in different ways, and this will be in a tune with their mental state. I can even say that most of us illness to further our mental state, or in other words, the state that we are furthering represent our true state. If we take a simple example like tonsillitis, a patient have acute pain in the tonsils could react in a number of ways. Like his attitude can be any of the following. He could say, this can lead to cancer, and I am interrupted at my work by this pain. I need support. How unlucky I am that this is happening to me only. How will task is my hand get completed? If I miss work due to this pain, what will be the boss say to me? These are the all reactions. In the most of this attitude, anxiety about the health could be the common feature, but there could be other attitude like this is due to my past karma. The pain is so severe that I do not feel like working, or I need to become extra cautious to avoid this in the future. To find out what is the basic attitude, one has to ask further and further, not leading question. For example, if there is anxiety about health, we have to find out why there is anxiety about health. Sometimes this comes out by itself from the casual remark of the patients, but most often from the patient's questions and doubts. If we keep this in mind, this idea about the patient's attitude to illness, then we will very alert for any such incident remark. We need to observe the word that he used to describe his complaint. Like case number 1, I had the case of a lady who had a intense sciatica pain. I learned that she was a college professor and was being troubled by her senior in some way, and she had to protest about this. She was very sincere in her work. So taking the feature, namely sincerity, niceness, and occasional sudden explosion of the anger from the feeling of injustice, and I gave her staphysagria, which did not work. I saw her again and again for many times, and she said, Doctor, this pain is troubling me so much. It is not allowing me to do my duty. As she felt that she was being troubled by the leg, and due to this trouble, she was not able to perform her duty, for which she felt guilty. I took the rubric delusion that he is persecuted, delusion that she has neglected her duty, and the anxiety of conscience as a guilty of a crime. Through this process of thoughts, I come to the remedy cyclamen, which ameliorate her pain immediately. Now case number 2. Another case was of a boy who had a stammer and said, I just don't know how I am going to get out of this stammering habit. I interpreted this to mean I am now trapped. I am making an effort to get out of this trap alone, and I have to help myself out. He could have said, Doctor, this habit is so embarrassing and only you can make me well. Or Doctor, how did this start and how long will it take to go away? I took the rubric fear of narrow places. Delusion succeed he cannot. Delusion deserted for second he is. And restlessness, anxious, compelling, rapid walking, and I arrived at the argentum nitricum. This is how an argentum nitricum patient will usually complain. Case number 3. I remember seeing a case with my colleague in his clinic. A lady had a varicose ulcer and she wanted to know whether homeopathy could help or not. My colleague told her that it could, but she was not satisfied with the answer. She said she wanted to know if he was sure that it can help. He said, and nobody can guarantee, but she can try out of this for a month and check for it work. Month and see how it works. You can use it for 1 month and see how it works. She was afraid it might bleed in my mouth because the surgeon had told her so, and hence had advised surgery. My colleague said, if she is so afraid of bleeding, then she can go in for surgery. Then she added that her friend had told her that after surgery the ulcer may reappear. At this my colleague asked why she was not waiting then. She was about to reply when I showed that my colleague was getting irritated and intervened. I could see that her main state of mind was her inability to trust anyone. And so I took the rubric suspicious, mistrustful, restlessness, anxious, anxiety about health, fear of death, and I gave arsenic album. What I am trying to illustrate is how the casual remark and the way the patients approach us can give us leading indication of indication in the prescribing medicine. Typically of the way a Brahmana patient will conduct himself when he comes for a consultation is that he will speak to the doctor as if he is talking to his financial or legal advisor, and you will get the impression that his health is matter involving a business deal. For example, when told he has a bad prognosis, he will typically sit back in the chair with the arms folded stiff and stand, and will ask very unemotionally and dryly, so doctor, what options are there open to me now? As if he is dealing with a business crisis. Here we could take the rubric delirium business talk of delusion business he is doing, and determine strongly determined. So that is a Brian Alba. Now case number 4. A woman 33-year-old came with asthma. She was telling about her complaint in great detail and with many fears, fear of ghosts, dogs, etc. In her case, took the rubric fear in children. Why did I so? Because her manner of talking and her fear were like those of the children. In this way, I have used a lot of rubric that are that are to do with the children. I have used rubric in adult like irritability in children, fear in children, obstinate children, religious affection in children. I have also applied the rubric desire to be carried in adult. This rubric means that he desired to put all his weight on someone else's shoulder and would like that person to bear the whole burden. When I find the person put the whole burden on someone as if his feet are too tired to support him, then I use the rubric even if he is an adult. Now under label accompaniment to the suffering. The state of mind that is produced during pain or suffering is often the state of mind of the patient in an uncompensated form. For example, a patient with a skin eruption may shrink. This pain is too severe. Please do something or cut off my leg. We see here violence, shrinking, abusive, and want of support. This is the state of chamomilla. These accompaniment are most important in case taking as they enable us to get a good picture of the patient. In the West, when experienced people talking in a term of depression or inferiority complex, for example, but without really taking of their true untainted feeling, and so observation and the accompaniment of the suffering are useful because they cannot make a fool of you. A villager is able to give mental symptoms more exactly than the educated. He will say, doctor, I get so angry, I feel like stabbing someone with a knife. But the executive from the multinational company with the same feeling will understand it and say, I am little irritable, but that is required in his professional in this profession, otherwise I will not be able to get my work done. Now another case, I remember a case of asthma which was not responding to treatment because of had hardly any mental symptom during the attack free period, and during the attack she would take allopathic bronchodilator and get relief. I had to admit her to the hospital and observe her during acute episode. I found that during the episode, which usually occur at night, she would develop tremendous anxiety and fear of death by suffocation. We also found that she was not willing to talk and was quite reserved. One of the physician's physical concomitant she developed was very marked hoarseness and loss of voice for no apparent reason. On the whole, we found her very mild, quite indolent, and she was worse lying down, worse during sleep, from which she would get up during an attack or breathlessness. She was timid, restless during the paroxysm and wanted an open air. Now, if we forget her physical complaint altogether and just consider her mental state, what symptoms do we have? We have below symptoms: anxiety at night, anxiety open air amulet, anxiety with a fear, anxiety during sleep, anxiety on waking, fear at night, fear of suffocation at night, frightened at night, mildness, reserve, restlessness at night, startling from sleep, talk indisposed to, timidity. When we look at these symptoms, the remedy which emerged in Spongia, and Spongia was confirmed from the Fatak Materia Medica, where he begins his paragraph on respiration with hoarseness with many complaint. Also, he gave fear of suffocation. This case gave us hint that if this girl has a cough at night and produce anxiety and fear of suffocation, then she must have a mental state which has anxiety at night and fear of suffocation.